Good afternoon, residents of Carleton Place. This is Mayor Black. In our continuing efforts to bring as much information to you, the residents of Carleton Place, as we can, I have reached out today to Dr. Stephen Walker to be interviewed by Councillor Fritz for the latest information and status that we can make available. I trust you will find this following video extremely informative, and do not hesitate to share it with all your friends and neighbors to repeat the slogan that we all need to adhere to. We are all in this together. Thank you for your attention, and thank you for watching today's video.
Good afternoon, Carleton Place. As Mayor Black said, I'm Councillor Theresa Fritz. I want to thank you for joining us this Easter Monday afternoon. We're here today to have a bit of a conversation with local family physician Stephen Walker. He's also overseeing the COVID-19 Assessment Center in Almonte, so we thought who better than to try and get the latest information as it affects our local residents. So we hope that you find this little discussion informative. Thank you for joining us, Dr. Walker.
Thank you for asking me.
Busy times for sure.
Oh, yes.
I'm wondering, you're a longtime family physician in this community. Can you kind of give us an update from a medical perspective and with your work with the Assessment Center? How are we doing in Carleton Place?
I think we're doing really well. All the family doctors have got together and we've divvied up the work, and I think that was the key thing here in terms of not burning anybody out, in terms of protecting PPE, and in terms of looking after people, because our practices just aren't set up to see potential COVID-19 patients in our offices. So that was the rationale behind opening up the COVID-19 Assessment Center over in Almonte. But overall, the changes we've made to the physical plant of the hospital, where we've actually opened up some beds on first floor just for COVID presumed or confirmed patients. We've really changed the way our emerge is. We've now got some negative pressure rooms, which the staff over at the Carleton Place Hospital performed a miracle basically in just shifting everything. And then just trying to get the public aware of the reality of this. I think the community's done a really good job.
One of the things we're hearing, obviously, based on what we're reading in the news, not just locally, but in the bigger picture in the province and even in the country, there's quite a lot of concern right now for residents in long-term care, and not just the residents, the staff as well. Can you speak a little bit to some of the safeguards that are being put in place for those vulnerable residents? And maybe after we can touch base a little bit on the staff, because there's another impact there as well.
Mm-hmm. I mean, the long-term care homes in this area have been hit hard. There's no question. And they are the most vulnerable people, unfortunately. And it's not that we aren't taking people from long-term care and bring them into the hospital, because there aren't treatments available for this. So it's not unexpected that long-term care homes get hit hard because of the demographics of who is there. Mm-hmm. So it's some of our local doctors, one in particular, he's done just a heroic job of, I think, caring for the people in long-term care and making sure that they're treated respectfully, and that the staff are made as safe as we can in these high-risk situations. Mm-hmm,
mm-hmm. What about the staff? Obviously, you know, you've got nurses, you've got doctors who go in and out, you've got PSWs, you've got housekeeping, you've got a whole slew of people who are there, and they live in our community, and when they get off a shift, they maybe need to get essential items at the grocery store. There's a concern, right, mm-hmm. that they're dealing in these high-risk situations and then going out in the community. Is there any messaging to residents to understand that they're doing all they can to be safe, but they still have to live their lives outside of their work environments?
Oh, exactly. And one thing I would say that we're all at risk. I mean, everyone I'm dealing with, I am assuming that they're COVID-19 positive. And I think if you go about your day with that attitude, it'll keep us the safest. I don't think the positives that we're getting back from the clinic, the demographics are, we just don't understand sometimes where these cases are coming from. Mm-hmm. There's probably a lot of shedding of this virus before you're symptomatic, or also you may not get symptoms of it. And that's the dilemma that we have. And so when you identify somebody who works at a retirement home mm-hmm. or long-term mm-hmm. care home or at the hospital, I wouldn't treat them any differently. I think we have to assume that everybody has this virus. We need to maintain social distance. We need to not touch our face. We need to wash our hands a lot. Which is the whole debate on masks. Are they helpful or not helpful? Because the risk is contaminating yourself by donning and doffing the mask incorrectly.
Yes, yes.
So I think the message is, these people going to work at long-term care homes are absolute heroes in my eyes. I mean, they're going into a position where we've identified it as a high risk.
Yes.
But I think everybody is in a high risk area. We mitigate the risk, we lower the risk by trying to keep our distance, but we certainly can't treat these people as being typhoid Mary. They are, they're doing a heroic job, and anything we can do to help them, go get their groceries for them, do whatever we can, I think would be helpful. But I don't think we have to assume that everybody who works in healthcare is infected. I think we have to assume that everybody could be infected.
I think that's a really good message, and I'm not sure what it looks like on camera, but we are maintaining the appropriate distance here. But sometimes perspective can be a little skewed on camera. Based on your professional experience, what you're reading, what you're seeing, talking to other medical professionals, do you think Carleton Place is holding its own? Obviously, there's talk these numbers are going to go up, even locally and maybe outside the long-term care residents. What's your sort of take on where we are now as a community and our numbers? And are people getting the message?
Judging from me, I'm unfortunately I kind of have to come into town every day to do something with respect to one of my jobs, and I would say that what I'm seeing now compared to what I was seeing 2 weeks ago, people are getting the message. I'm not seeing the congregations of people. I see a few times I see like a few people bundled up a little close, and it really kind of makes me nervous. I have to put my hands in my pocket not to shake someone's hand when I see them. These little things that I'm having to change up, but I think it's going to take a while for everybody, but I'm pretty impressed by what's happening. I've seen a number of patients with COVID-19, and everything from very, very mild cases to quite severe cases.
Yes.
I don't work in long-term care, so I haven't dealt with the deaths that are from COVID-19 personally in my practice, but my coroner work has taken me there. And I think overall, compared to our sister communities in the area and globally, I think we're doing well. I think the advantage we have in a community like Carleton Place and an area like Lanark County is we have space.
Yes.
And that's one thing where you look at the places that are hardest hit, they don't have the space.
Yeah, for sure. I think this is an important one, and I've read about it a lot on various social media channels, and you hear people talking about it. What if someone thinks they have symptoms and they're concerned? What should they be doing? Do they go to the assessment center? Do they go to the Emerge? Do they go to their physician's office? What do people do if they're legitimately concerned?
Great question, because I wake up every morning thinking I have it. My wife does as well, and then we realize we don't.
Yes.
I think the first thing is that we have to prioritize things. If the symptoms of COVID-19 are very broad. They generally are fever and a cough and shortness of breath. They can be other symptoms, and especially in our older and most vulnerable, that's where the symptoms can really throw us for a loop. So one thing we've always had here since we've started the assessment clinic and what the Almont Family Health Team was doing prior is we have to have a good strategy for testing. And a couple of things. So if somebody were to develop mild to moderate symptoms, a few things about swabbing. We don't want to swab them on the first day. The amount of virus in the back of their throat and the back of the nose is just not enough to pick it up. So if somebody is feeling that, gee, I really need my swab today because my symptoms started this morning, the worst thing would actually be getting back a false negative test, because then you think you're clear and you just got your swab a little too early. So we're trying to swab people on day 2 or 3, and the access to that is either through their family doctor, through one of the local emergencies, or through the public health unit. So if somebody has a family doctor, primary health care practitioner in Carleton Place, and most of us are basically trying to carry on our practice through phone or video link up. But if somebody were to have mild to moderate symptoms of COVID-19, what the family doc's doing, everybody in this area knows the number. There's a number that the doctor calls, and they speak to the booking person. They say who they are, they say who the patient is, and what the symptoms are. And one of our bookers, which is a nurse, calls them and talks to them about their symptoms, talks to them about isolation, and will basically arrange for a swab based on the priority of their symptoms, when they started, and how severe they are.
Okay.
We've got basically 3 tiers of swabbing we're doing at the assessment clinic. One of them is a drive-up swabbing, and they're by appointment only still, but your doctor or the public health unit can arrange this. And basically people literally drive up, we confirm identification, and we swab them. And that's been going really well. We've got a lot of help from Lanark County paramedic services with that. And then we have what we call our B clinic, and that is, I've been working there a few days a week, where we actually have a nurse and a physician working inside of a clinic. We've converted the old ambulance bay outside of the Almont Emerge. And we're seeing volumes that are very variable. We've seen, as low as 1 or 2 people to as many as 8 or 10 people during a day. And these are basically people who have mild to moderate illness, and we need, the nurses or the doctors have said, well, we need someone to put a stethoscope on this person. We need somebody to look in their throat or look in their ears.
A little more, basically.
Yeah, exactly. And I'm
Yeah.
seeing patients over there that I would normally see in my office, with flare-ups of emphysema or asthma flare-ups, those sorts of things, because at least I'm in PPE. We've got a controlled setting. My nurse is in PPE, and we can clean the room between each patient. So it's a good way to do it. We also have what we call our C patients, which are the ones that the paramedics have actually been going into people's homes and doing swabs. And now that we've been in business for a couple of weeks, we're now starting to get to the point where we're going to have to confirm that people who were positive are now negative. And healthcare workers, we need to do that 2 times.
Okay.
So the next coming weeks are going to be pretty busy with that kind of
for
priority
sure.
of getting everybody through and registered and trying to appropriately triage them into the right clinic. But anybody who, and we are not swabbing asymptomatic people. The only asymptomatic people who will be swabbed are people who are leaving a hospital to go back to either a retirement home or a long-term care home.
Okay.
But the reason for, there is a big outcry in some jurisdictions to test asymptomatic people, but you may be falsely reassured that they're negative, whereas they're just in the early stages of the disease. And really it doesn't change anything, because it doesn't mean that you don't have to practice social isolation.
Of course.
If your swab comes back negative.
Yes.
So, in terms of trying to, I always look at, we've got 3 commodities that we've kind of got to preserve. We've got swabs. They're not an infinite number, and if we use them too freely, we'll run out. The second thing is PPE. We are burning through a lot of protective gear right now, and we have to be mindful of that. We have adequate amount now, but I think it's because we've used it properly. And the third one is manpower. If we burn out all our doctors and nurses and healthcare staff, there won't be anybody left.
Yeah,
So
that's a valuable
those are the three
resource right now, for
those
sure.
are 3 commodities
Yes.
we're trying to keep a handle on.
Yeah, and I guess the other thing that, obviously we talk about Carlton Place and Mississippi Mills, but we're all one community, we're all Lanark County. So all the efforts that are going on with the assessment center, it's a combination of resources from Mississippi Mills, Lanark County,
very
Carlton
much.
Place. It very much is a team effort to try and knock this down and deal with it.
Exactly.
It's location, where something is located, really doesn't matter. It's here to serve the community.
Exactly.
Yes.
Our mandate of the clinic is we've been trying to serve basically, Carlton Place, Almont, Beckwith Township, up to Pakenham. The dilemma, of course, and we see this sometimes in our emergency rooms, is through convenience, some people will take the drive. But, when we're limited in resources, we're certainly trying to limit that.
Yeah. Well, this information has been incredibly helpful. I hope our viewers have found that. I'm just wondering, from your perspective, obviously, a longtime member of the community, as well as a medical professional, what other messaging do we need to get out to people? I mean, we hear it all the time. We hear about the social distancing. We hear about no more than greater than 5 people in your house. What else is there that we really need to reassure people? If you do these things, you put yourself at the greatest chance of remaining illness-free.
Yeah, I think it's, we have to look at this as a bit of a marathon. This isn't just going to end quickly. I think one of the things is we have to look at some of the traditions we've often done and really rethink them. Simple things like handshakes are maybe gone out the window. Things like, getting together with a bunch of people in a small area. I think we're really going to have to rethink this. I think this has been something that, up here in the Upper Ottawa Valley, we weren't really impacted by SARS like the people in Toronto were.
For sure.
We weren't really affected by MERS. There's a
Yeah.
few things that have passed past us, but this is right in our community. So, I think the social distancing, I think is the most important thing. Just being mindful that every single person you're sitting across from could be, a potential source of this virus. And so I think everyone's doing a really good job. I think, I keep hearing things like, what day will this end? And it won't end. The dilemma is if we treat it that way and try to go back to what used to be our norm, is that we will just be right back into the thick of it. So I think what we have to look at it is when are we going to be able to phase in some of the things that we used to enjoy. And certainly, things like sporting events and things that we really do for our mental health are going to have to creep back in, but we're going to have to put real limits on it. And I think that's something for public health and all of us to kind of noodle on and figure out what the priorities are and when we can do that.
Well, thank you so much. It's been
thanks for
very
having me.
informative. We've been talking with Dr. Stephen Walker, and please come back and visit our website and our Facebook page. There are daily updates, and you can reach out to any member of council or the mayor at any time. Thank you for watching.